Assalamu alaikum. Hi there all. My name is Aarfeen. I'm working as a volunteer with Pakistan Red Crescent Society. I got a chance to prototype my idea and observe the advancement of the project for PWDS, people with disabilities. In my opinion, a single picture cannot convey the whole message, enabling the people with disabilities to understand the situation. So it is necessary to come up with a sequence elaborately explaining the situation a disabled person is confronted with and how to deal with that particular situations, especially for the visually impaired people with disabilities. Addition of these pictorial messages in the Braille language seemed necessary to me, which I did accordingly. After the first presentation, my mentor from IFRC advised me to make certain changes which would be non-elaborative to convey the messages easily and in complete comprehension. Feedbacks, suggestions, advices, surveys helped me a lot from PWDs and healthcare facilitators, and it gives me an idea to develop emergency services and rescue helpline only for PWDs. IFRC mentor advices gave me a new horizon to design a simplest and easy access app for PWDs, people with disabilities. Two segments involved in creating this kind of essential awareness. First, we have to develop a pictorial manual along sign language and Braille. During pandemics like COVID-19 outbreak, first step will be preventive health, first aid, psychosocial aid, or any preventive awareness trainings that can help the communities at a high level. Second segment is emergency services helpline and rescue app, easy to access specifically for PWDs to avail emergency rescue services or guidance on health and preventive steps during pandemic or disasters or climate change. On this emergency aid portal for PWDs, they can sign in via thumb impression or national identity card number. A screen will splash, enabling the GPS locator of aid seeker. A professional interpreter will be enabled on video call and voice call for blind people as well. Two icons will pop up. One will be emergency and the other will be the guidance. If the aid seeker click on emergency, following icons will pop up. They are looking for an ambulance, first aid, fire brigade, police, natural disaster, human disaster, or anything related to climate change. If there will be a tracking record and auto tracking ID will be generated, so the facilitator on the screen will keep on tracking the aid for the aid seeker. If they click on the guidance, they can avail the facility of preventive helps or preventive awareness on COVID-19 or any other pandemic, first aid, psychosocial aid, climate change, natural disaster or human disaster. A group of 50 persons will be engaged comprising of blind, deaf and physically handicapped people. They will be provided appropriate training by Pakistan Red Crescent Society to understand the laid down procedures as to how to understand the pictorials and act accordingly in any kind of emergencies where they may require help and assistance. So their response to these trainings will determine the effectiveness of this initiative. If proven positive, it would be spread further to other parts of Pakistan, encompass all the people suffering from any sort of disability. Emergency Services Helpline E8 portal, the participants of the program will be made aware of the facilities and advantages they have on their fingertips to call for help on any sort of assistance post-haste. Yeah. My idea will very smoothly integrate with the ongoing global initiatives to help and facilitate all those people suffering from any kind of disability. I believe the app and the manual I'm presenting will only come to enhance initiatives already being made from various forums. Only my initiative, I believe, be more efficient and more friendly for the people with all sorts of disabilities, whether they are visually impaired, physically impaired, or deaf and mute people. The Emergency Services Helpline only for PWDs will pave easiest access to avail emergency services and guidance on any pandemic like COVID-19, natural or human disaster, climate change actions and preventions.